Welcome to the Academy of General Dentistry podcast series featuring Dr. George Schmidt. Each episode features experts in the field of dentistry who share insights and inspiration to help you succeed. Let's get started.
Welcome back, everyone. We've got another great show for you today as we welcome the current president of the FAACD, Dr. Adamo Notarantonio, to talk about cosmetic dentistry. But before we introduce our guest, make sure you subscribe to our channel, hit the like button, and ring that bell. That way, you'll be among the first to be notified of all things AGD. Adamo, how are you?
I'm doing well. I'm doing excellent. How are you?
Great. So great to have you on the show. Really looking forward to some great conversation. And it's really, really special for me to be able to chat with you, someone that's so accomplished in cosmetic dentistry. Before we start, let me just tell the audience a little bit about you. So Dr. Notarantonio is a graduate of the State University of New York at Stony Brook School of Dental Medicine, where he received honors in both removable and fixed prosthodontics. His memberships to professional organizations include the American Academy of Restorative Dentistry, the American Academy of Cosmetic Dentistry, the American Equilibration Society, the International Congress of Oral Implantologists, the Academy of General Dentistry, and the American Dental Association. Dr. Adamo was accredited by the American Academy of Cosmetic Dentistry in 2011 and received his fellowship in the FAACD in 2018. He is the current president of the FAACD, credential, examiner, and fellowship chairman. Adamo is a graduate and faculty of the FICOI Center. He has received his fellowship in the International Congress of Oral Implantologists. He is published in multiple dental journals and lectures nationally and internationally on topics as CAD/CAM dentistry, implant dentistry, cosmetic dentistry, composite dentistry, and dental photography. And Dr. Adamo is the co-founder, along with Dr. Amanda Say, of the Impress Lecture Series in Charleston, South Carolina. He's an avid golfer, as I am, a sommelier, and is fluent in Italian. So that's really special. And we're going to talk a little bit about the Impress Lecture Series before we get off, for sure. I want to hear more about that. But, as many people know, you're going to be with us at AGD 2025, July 9th through 12th in Montreal. And we're really looking forward to that. I know I'm looking forward to that. And you've got a couple of great courses there dealing with composites. So I guess I want to ask you right off the bat, because I know over my career, over nearly 30 years, when I think of sort of aesthetics and cosmetic dentistry and things like that, I always think of, it used to be Empress and now it's Emax. Where does composite fit into that? And what role does that play?
That's a great question. I think composite gets often overlooked. And I think, with this splurge in social media, it's even more overlooked because we see a lot of, 20 units of porcelain and this and all that fun stuff. But, for two reasons, I think composite's fantastic. And in my lecture, I'll talk about a couple more reasons. But number one, it's ultra conservative, right? So I'm not doing veneers on a 16, 17-year-old kid. Somebody comes in with a fracture. And honestly, why would you put any less effort into fixing a class 4 on a 15-year-old than you would doing a veneer on a 35-year-old? I mean, there's an art to it to be able to do that. The other thing for me is I personally think that in order to be the highest level of cosmetic dentist, you need to be able to handle composite. Because if you're relying solely on your wax up, whether it's analog or digital, and you're relying on your ceramics to do anything, once that provisional, which is resin, goes in the face, if it doesn't look right, how do you fix it? Do you understand line angles? Do you understand surface texture? Do you understand how to make a wide tooth small? That all happened with composite artistry, not because I just happened to pick up a disc and do it. I had to learn how to handle, manipulate composite, be able to create different illusions. And I think that's what made me a better cosmetic dentist. So without composite, I hear a lot of cosmetic dentists say, I don't deal with composite. I find that hard to believe because if you're doing provisionals, you're handling composite. And if you're not modifying them, then all your cases are not going to come out perfect because, yes, I love when my wax up is perfect in the face, but the reality is that is very rare. There has to be something. And whether it's opening incisal embrasures or adding length or shortening, composite artistry is huge in that sense alone, not just for, repairing fractured teeth or closing diastemas, but your provisionals, that's what you use. You use resin to make these adjustments. And I think it's a really, really big factor in elevating your game in cosmetic dentistry.
Yeah, and that speaks largely to, you as a professional and as an artisan, because I think a lot of people, it takes a lot of time. It takes time not only to do the case, right, but to learn how to do that properly and to spend the time with the patient. And I think frankly it comes down to sometimes that people just it's easier to just take an impression and send it out to the lab, which is unfortunate, right? Because you get what you get back from the lab sometimes.
No, it's true. You know, I was having a discussion with someone here at the Koi Center recently, and we were talking about provisionals. And I said, listen, my ceramics are great, but I will tell you right now, my ceramics copy my provisionals to a T. Their art goes into the layering and the translucency and the halos and the texture, but you better, the length, shape, everything better look identical because that's my test drive. That's my roadmap, right? So if I didn't know how to handle resin or make those adjustments, I could tell them in a picture, hey, number seven looks a little wide. Well, how do you want me to reduce it on the distal line angle, the mesial line angle, change the axial inclination? You have to know how to manipulate and do that with resin. If you don't, you're relying on someone else to do your artistry, and I'm just not a big fan of that.
Yeah, I agree with you 100%. No question about that. So walk me through your approach when you see a case that comes into your office. Walk me how are you looking at that? When a patient comes in, when you see that, are you thinking composite right away? Are you thinking maybe ceramics, maybe composite? What's the best? How do you take all into consideration to make your decision?
I think first off, one of my main decisions is what is their chief complaint? A lot of people come in and say, I don't like my teeth and I don't know why. And, that's my job to say, okay, a lot of times I see patients come in with kind of nice teeth, but really open incisal embrasures. And that's a home run composite case because all I have to do is close those a little. It's a little edge bonding and they look beautiful. Um, it's also tooth position, right? So if the teeth are a little facial or in a proper position, I could do a lot more with composite conservatively than I would with veneers because if I need to change the position, I'm going to have to prep, right? So position is another factor. The other thing is financial. I mean, my composite veneer fee is not cheap. I'm not going to lie. About half of my porcelain fee, but I give them both options. And there are times when I just can't do it with composite because the color change they want is too drastic or it's just too much. So if I look at the more conservative cases, I look at their chief complaint. I look at tooth positions, huge for me. And obviously, severe color change probably won't work with resin unless I'm bringing teeth out a lot and I'm going to be, layering a millimeter or 2 millimeters, which is rare. The composites I do that cover full face or composite veneers are very minimal. So tooth color change is not super drastic.
Mhm.
But those are some of the factors that I look for when I make my decision on composite versus porcelain.
Yeah. So when you have patients come in, a lot of patients, I'm sure, especially with your notoriety, they come in and they're asking, hey doc, can you fix me? I don't like, this and that. But how do you approach the patient? What do you say? What's the discussion you have with the patient that you say, oh boy, I could do so much with these teeth, so much with this case, and they don't necessarily realize that that's an issue or problem. How do you bring that up with these? How do we bring that up with these folks?
Yeah, I try to give different layers of, I don't want to say, how do I put this politely to them? I don't want to overwhelm them right
Right,
away.
right.
So
I-
I'll say, we can make some minor changes with a little bit of composite on the edges. And I'll actually do a direct mock-up right in the mouth, right there on the spot. Takes me 3 seconds. I'll show them with the mirror. I'll pop one side off. Let's say I do 7 through 10 or the anteriors to give them a little idea. But then I say, well, if is that the only thing you don't like, or is there more? And they're like, no, I want a fuller smile. And that's when I start saying, okay, now the more teeth you give me, the bigger the canvas I have, the bigger the painting I can paint for you. If you limit me to the front four, there's only so much I can change, and I can show you that. But if I have more canvas to work with, then my art can go to another level. So I can broaden the smile, I can change shapes, I can change positions. Whereas if we're only going to focus on the front couple teeth, it kind of handcuffs me a little bit, which is fine because you might not need or want more, but we have options. So I usually try to start small, not overwhelm them. But if they do say, I want fuller, I want more, then the door's open and then I could kind of go anywhere I want with them.
Yeah. So are you doing that? Are you doing that on the initial visit when they come in? Are you doing that mock-up, or are you going to have them do your records and so on and so forth, and then have them back for like a consult and show them that on the spot? Let me throw some composite in here and show you what this can look like.
Yeah, it's funny. That approach has changed over the years for me. So back in the day when I guess I wasn't as well known and wasn't getting direct referrals, I used to bring them in and then take all the records and do the wax up. And I wouldn't even charge for it because I just was trying to wow them and show them all this stuff.
Yeah.
I don't do anything now. I don't even take a picture on the first appointment, except if if they need edge bonding or size, that I'll do in 2 minutes. But I just talk and show them a mirror and say, hey, this is what we can do. If you're interested, I can have a workup done, and then you'll come back and I'll try it in and show you what it looks like. And most of the time they say yes, so then I'll take the records there. But when I first walk in, there's no camera, there's no computer. I don't even take a picture of their mouth. I just look and say, okay, I think you need this. And most of the time they're like, okay, what would that look like? And that's when I go through the next process of, for me to show you, I need to do this. There's a fee associated with it. We can do the records today and I can have you back in 2 weeks to try in and see. And most of them move forward with that.
That's so interesting because I know a lot of folks when, on the initial record, they'll scan, whether it's one of the scan, a digital scan, and they'll do that and a mock-up and all kinds of things. But you're not doing any of that. You're basically just giving them, you're looking at it like an artist and saying,
Yeah.
Here's what I can do for you.
Well, it's funny because I never really knew how to explain this, but when I teach with Amanda, I think she says this great. And on that initial visit, I made it simpler because as she would quote, she would say, I'm not trying to teach them how to build an airplane. I'm just trying to give them possibilities. These are your options. Later on, if we're going to move forward, then I will tell you every step on how we're going to build that airplane and show it to you. But for the first appointment, I want a quick consult. I want to spend maybe 15, 20 minutes with you. I want to tell you, this is what I vision. And then if you like me and you want to move forward business-wise with me, then we could take the steps. But now the more I look at it, the more time and money I wasted on without having a conversation with someone just to take all these records and get all this
Right.
wrap-up done, and they didn't do the work, right? Because they might not like me. They might not be comfortable with me. So I feel like that first appointment, you're coming from my expertise. Let's just have a conversation, like we're chatting over a glass of wine. And if we hit it off and you're comfortable, then we can start talking about this plane that we're going to build for your mouth and your smile.
Yeah. What do you say to the listener out there that's, they've got a heavy insurance-based practice? And then we're talking about composite, where the reimbursement might not be as good or, as we could get otherwise. What do you say to that person and how can they approach this type of dentistry? Because it's amazing. It's life-changing for the patient and many times for the practitioner to be able to have that fulfillment. But what do you say to those folks?
For me, in the beginning, I did a lot of stuff at very reduced fees. I did a lot of stuff for free. I would throw in stuff just to do it so people would start to get comfortable, or like they would come in for 4 veneers and I would be like, well, 4's not going to work. I need 8. And I would just do it so that they would be like, wow, this guy's good. And then once the credentials became attached to me, I don't have to do that anymore. So I would say in the beginning, if it's what you want to do it for what it is. And maybe you're not going to make as much as you will down the road, but I promise you, if you invest in yourself and your skills, word of mouth spreads really fast. And then you can see all of a sudden you can start increasing fees or tell them, hey, I could do this, but it's going to cost more than your insurance because of the materials and the technique and all that fun stuff we're going to use. So I think the big step is when you're in that mindset, especially the younger dentists who come out with all this debt and all they want to do is make money, they're not focusing on being better. They're focusing on, I need to pay my bills, which I get.
Yeah.
But if you can get that mindset of, I want to make myself better, I know I have to work hard now, and then in the end, later, I can make the same profit off of one patient than I did off of 9. That's a whole different style of dentistry. It's so much more rewarding. It's so much more relaxing. And I think it's an avenue for everyone, but you have to get yourself out of that mindset of, I'm only doing this for a living. And if you don't have that mindset of, I want to be great, it's useless.
Yeah, I love that you said that because I think so many people don't think of it that way. Like invest in the greatest investment you can make is in yourself. And we believe that at the AGD. I know you believe that at the AACD. And you've got to approach some of these cases as, hey, this is just like going to a court. Like I'm going to pay to go to a course. Why don't I just do this extra work for a little less fee
Mhm.
as I learn my craft, as I explore, as I figure out, push my boundaries and things like that. And I think if you take that approach, that's amazing.
Yeah, I mean, listen, I'll tell you a true story. My accreditation case, one of the case types is 6 or more direct resin veneers. And granted, yes, I photographed it and I took my time and I did it after hours and I did it for free and it was on my cousin's wife. But it was 11 appointments at 4 hours a clip. Now, if you think about that financially, I lost my shirt, my pants, everything. I didn't make
Yeah.
a dollar. But I got so much better each week. And then by the end, I was like, wow, now I can do 6 composite veneers in an hour, hour and a half tops. And if you think about it, my ROI on composite veneers is 10 times porcelain because there's no lab bill.
Yeah.
There's no outside chair time. There's not 6 appointments. There's one or
Yeah.
two max. So that's when you start to see the benefit of all the hard work you did, all the education you did. I mean, I spent way more money on CE after dental school than I did on dental school between Dawson, Coyce, all the AACD stuff. I mean, but was it worth it? 100% it was worth it. It was, I would do it again and again and again tenfold.
Yeah, you're preaching to the choir here for sure. So when you do these cases, are you doing these? So when you do these veneer cases, are you doing them freehand? Or are you doing some type of injection molding? What's going on here when you're? I mean, I know this is a whole weekend
Yeah, no,
course,
no,
but
they're great
let's boil it
questions.
down. Yeah.
I mean, at this point, I'm more comfortable freehand. I used to get wax up dones for lingual shelves. If I have a lot of 2-3 build and I want to make sure I don't have too much occlusal adjustment, then I will do a putty and a wax up. Injection mold, I really reserve for. I do that a lot with peg laterals on kids because it's easy to control the emergence and all that with me because we know what their tissue is like. So it's not all that easy to freehand there. I that and what I use injection mold more for are basically transition on full mouth cases. So let's say I have a worn dentition case, which I'm going to show in Montreal. The orthodontist wouldn't even know where to put the brackets. The teeth are so small. You don't know where the axial inclinations are. So we design the cases to full contour in the axial inclination, rotation, and position they are. Injection mold the whole mouth, and then put a turbo bite on the lingual so the orthodontist has some room and they're not going to break everything. And then they bracket them, move them, and line them and get into place. So it's an orthodontist dream because now when they're coming, instead of 3 millimeters of teeth showing, they have a full 10. They know the angle rotation. They could bracket and align the arch, the roots, everything ideal. So that's what I use injection mold more for, not so much aesthetics, because at this point I'm pretty skilled at composite layering. So it's not hard for me, but for other people who struggle with different shapes and emergence and even texture and stuff, injection mold is amazing. The problem with injection mold is it's monochromatic. So if you want to add back, sometimes you have to cut little windows, which is fine. I'm just pretty fast with composite, so I don't do it for aesthetics. I do it more for functional cases. And like I said, for peg laterals for kids, it's a home run.
So you're doing it to stage long-term cases, perhaps, where
Yes,
you're gonna do everything and then maybe even come back and restore a quadrant at a time
100%.
after you open that up. And you kind of answer one of my questions because I think one of the biggest challenges there is that it's really monolithic. It's monolithic, right? When you're
Yeah,
doing the injection molding, but you're just basically cutting back and layering in composite to get your shade, whatever you want.
that's it.
Yeah, that's good stuff. And what about like from a armamentarium standpoint, I'm 100% rubber dam, right? Isolation. You're gonna want
Always,
all that.
always.
And then what are some of the like the absolute I've got to have this to do my composites. Don't try without it.
Prep start or air abrasion is one.
Hmm.
I love a modeling resin, brushes. Um, the easiest way to break it down for me is I need a very thin, flexible instrument. There's a couple on the market. There's a Cosmetic one, there's a clinician choice one. I don't care which one you use, but that'll help you with maneuvering little areas and also creating the dent and diffusionary lines when you're breaking up the composite. And then a big, stiff instrument to carry bolts of composite as you're doing your layer. So as long as you have one or the other, Amanda and I have a kit we use at Impress. Some of them are her instruments, a couple of them are mine. I can use anything as long as I have one that's thin and flexible and one that's big and bulky. So it gives me a little best of both worlds.
And what kind of composite are you using?
That's a great question.
Right.
I pick I don't use microfills. I use
Okay.
nano hybrids.
Okay.
Not because I don't like microfills. The reason I pick my composite is very simple. It has nothing to do with the company, it has nothing to do with the color because they're all beautiful.
Mhm.
It has everything to do with how they handle. So I don't love super stiff. I like them a little softer so I can play with them and maneuver them a little better.
Yeah.
So that's why I pick composite. People ask all the time, which composite do you use? And I say, listen, I'll give you my actual carpule, but might not like the way it feels. And that's the difference between anybody who teaches or educates on composite artistry will tell you that feel is the most important because, I mean, these companies aren't dumb. They're making beautiful colors now and
Yep.
strength, and they're really good. You just have to find one that you like. You understand the color system
Right.
and that you like the way they handle.
Right. Because what works in my hands might not work in your hands and so on and so forth.
100%.
I think we all have to understand that. You can't just go to a course and see what somebody's using because it may not work for you, but you're absolutely right. And then what about, just back up a minute. So you mentioned peg laterals before. How are you getting that? How are you getting that emergence profile on the on the small peg lateral to come out? I mean, a lot of people, I've seen a lot of cases where people, it's just too bulky or they've got the big overhangs. How are you getting that? Are you going down sub G? Are you going to pull that gum back and go underneath, or so what techniques are
Yeah,
you using
so
there?
I use a very, very thick latex rubber dam when I can use latex, and it basically retracts this papilla tissue, pulls everything down out of the way. If I
Okay.
need more, I'll pack Teflon tape rolled up like cord to
Uh-huh.
push it down more. And then if the design is right, and I hold the matrix when I inject properly, I almost have no adjustment.
Wow, that's amazing. And you're going, when you say you're freehand, right? You're not even using like a putty matrix on the lingual there. You're just basically straight away going
Well,
freehand.
for peg laterals, I do injection mold, so the design is done,
Right. Well,
right?
I'm jumping around a bit. Yeah. Yeah.
But if I'm doing like a class four, a lot of times I just use because most of them come in for emergency. It's not like they're coming in with half a tooth and then I'm going to send you home because I have to do a wax up. So
Right.
I usually build up in one shade, which is a technique I'm going to teach when I come. I use my finger as the lingual matrix.
Yep.
I build it up in one color, make sure that I cover the crack line, adjust the occlusion, and then I cut a window out just like a lab tech would after they press a ceramic. And then I could layer my Maverick colors and all my micro stuff in there.
Yeah. Oh, I love that. And nice big bevel on the facial, I'm certain.
Yes, two bevels for me when I do class fours.
Okay. So what do you mean
Deep
two
and
bevel?
shallow. So the deep one is the one really indented, and then my shallow is a regular, like a starburst that goes up the face of the tooth so that that facial blends in good. I don't do the infinity all the way up to the margin. I prefer the what they call the starburst or
Yeah.
the whatever bevel.
Yeah. So it's in a regular line.
Yeah.
Yeah. And then what about polishing? Basically using
Polishing,
discs or
I used to use discs, but I find that when I was adding my secondary anatomy, my pericomata, if I went too far with the discs, I devoured everything. So I do rough shape with the discs, and then I do a pre-polish with a silicone wheel. I'll add my pericomata or whatever, and then I'll just do a high shine with a second silicone wheel, or if I need it even glossier, I'll use enamelize on a flexi buff disc, some aluminum oxide paste to polish up the tip.
yeah. So I know you're going to talk about a lot of this stuff up in Montreal again, that
Yeah,
like July 9th through 12th that we said in AGD 2025. I'm really looking forward to dropping into your course and seeing this stuff. That's
thank you.
fantastic.
Thank you.
Really good stuff. You also mentioned, you told us about the 11 visits with your, I guess your cousin or your aunt there to become a fellow in the AACD. So for our listeners out there that want to go down that route, they want to become a fellow, they want to become more involved in terms of cosmetics. What does it take to do that? What are the qualifications or what do you have to do for that?
Time, patience, and a lot of tissues because it can get a little bit emotional when it doesn't go your way. I'll tell you from
Yeah.
experience, I know. My first recommendation to anyone who's interested in it, just sign up and go to the annual meeting. For me, that was life changing. My first scientific session was in 2007 in Atlanta, and I remember walking around and seeing the posters of the newly accredited members, and I was like, "Oh my God, I would kill to do work like that one day." And then I just got motivated, and I started the process. And I began accreditation process in 2009. I got accredited in 2010, 2011. Um, and after that, then I went for my fellowship. But once I started doing dentistry and documenting it like that, I could never unsee the dentistry I did before. So it totally changed my aesthetic eye. It changed the level of dentistry that I wanted to deliver to people. I would not be anywhere near where I am if it was not for the AACD and for that process and for my mentor. I mean, my mentor was the most phenomenal mentor. He pushed me super hard. it's funny because we examine together now, and I'm like, you passed that? I go, you would have killed me if I
Uh,
gave you that. And he goes, yeah, but not everybody's Adamo, so I was a little harder on you, which is kind of humbling, right? Because he mentors a lot of people. But yeah, my eyes grew in
yeah.
exponential going through the process, and now as an examiner, and I'm the fellowship chairman now. I mean, I probably see, no exaggeration, I'm going to say 200 to 300 cases a year,
Wow.
if not more, that I either grade or mentor. So all day long, I'm getting emails with PowerPoints. What do you think of this? So, yeah, I mean, you learn to see things that you would never even dream that were there, or you didn't even know that that's how they were described. So
Yeah.
it's, I would recommend anybody who's interested in cosmetics to at least go. Not necessarily mean that you have to do accreditation or fellowship, but just to see that level of dentistry, to be surrounded by like-minded, motivated people. That's where the beauty of the academy is.
Yeah, and I didn't go down the AACD path with cosmetics, but I can relate to what you're saying because when I went from analog to digital, I was prepping crowns for, for years and years and veneers. Okay. And everything you think is fantastic. And then you get a scanner out, right? And you're scanning everything digitally and you blow that up to put your margins on there. You're like, oh my God, did I do that prep? And
Yep,
you learn so much about yourself and you become such a better dentist
100%.
after that. So yeah, that's fantastic. So I know you teach a lot of this stuff and you're wearing the shirt right there. Impressed. Tell us a little bit
Yeah.
about that program that you're on.
Yeah, it's funny. So I met Amanda randomly at a conference in Austin, Texas in 2017. I knew of Amanda. She was very big with Ivoclar, and we just hit it off as friends. And about a year after that, we did our first 1 day composite course just to see if we would be compatible, if we could teach together. We did it in Charleston, which is where Amanda's from. It's close to me. I'm in New York, so not too bad. And it went off super well, and people were asking for more, and they wanted 2 days. So we decided the year after we started Impress, we gave it a real name, and we had three 2 day hands-on courses. Our courses are probably 25% lecture, 75% hands-on. We are not sponsored by any company. We just get basically consumables from 6, 7 different companies. So in our composite course, you can try 6 different kinds and then you figure out which one you want to go buy. So that was a big thing with us. We did not want to be corporate at all, which we're not. So we started with a composite course. We started with a bonding and rubber dam course, and we started with a photography course. And then a year later, we added smile design and injection molding. And then a year later, we added veneer prep, temp, and impression. So we have 5 different courses in our curriculum. There's no order to them. You can kind of just take what you want to get better at. But our main theory and thought in our education that we deliver is super, super hands-on. So we want you to be able to go home Monday and do exactly what we taught you on Friday and Saturday.
Yeah, that sounds amazing. I mean, you've got 5 really great courses there, and we'll get some contact information for folks that want to sign up for
Awesome.
that.
Thank you.
But in your bio there, you said you were an avid golfer and a sommelier, and you speak fluent Italian. But what you didn't mention is photography, because I looked at your website and I saw some incredible
Thank you.
photography by you. Yeah, so that's got to be one of your passions.
Yeah, it was funny because I always, when I started doing accreditation, obviously I learned how to take good dental photos. And then in 2015, I had no social media presence at all, and people were pushing me to do it. My assistant was like, start Instagram. And I'm like, what the hell is Instagram? I don't know what that is. So I signed up and I started seeing photos from these 2 guys from Venezuela, and they were the most beautiful dental photos I've ever seen in my life. So I contacted them and I said, listen, I don't care what it costs. I'm going to fly you to New York. You can stay at my home, because normal people just invite random Venezuelans to their house just to stay.
Yeah.
So they
Yeah,
stayed with
you
me
got to be
for
really
about,
careful about that
oh
nowadays.
my
But
God. So they stayed with me for 4 days. We ended up, we're the best of friends. I started teaching photography with them, but they taught me photography at a whole nother level. And
wow.
at that time, I started getting into like the lip art and the makeup stuff, and
Yeah.
I ran with it. So I've been doing that I mean, I was doing lip art before I was considered a freak, to be completely honest, back then.
Yeah.
Um, but I've been doing it for a long, long time. And actually, last November, I released my first book, which is 10 years of all my makeup art. I just put it on paper, a coffee table book that I sell on Amazon. I don't make a dollar off of it because
Yeah.
it's just something that I'm proud of all the work I've done for the years, because many hours of after hours with a makeup artist and models and all that crazy stuff for many years. So it's fun. I love it.
Yeah.
I got hooked on the art of it.
What an amazing story. I would have never guessed that that's how that whole thing came
Yeah.
about. Inviting a couple of Venezuelans up to spend the weekend at your house or whatever
Yeah,
it was.
it's insane.
So I would absolutely encourage our listeners not only to check out Adamo's dentistry, but also to look at his photography because it really is
Thank you.
fantastic. Some of those pictures are amazing. And
Thank you.
share your contact information with us for folks that might want to have some questions for you. Maybe they want to come to
Yeah.
your Impress course. Maybe they want to book you to speak, whatever the case may be. How do we get a hold of you?
So I would say probably the easiest way for me is either through social media, which my Instagram handle is Adamo Elvis. Elvis is my middle name. People think that I just love Elvis Presley, which I do, but I didn't like it when I was a kid. And then as I got older, I learned to appreciate the Elvis. My website is adamoelvis.com. My email is adamoelvis@gmail. So it's pretty easy to find me because everything is the same. And then my courses with Amanda, our website and our Instagram is impress with one S, IMPRES courses.com. And our Instagram is impress courses. So all of our information's on there. Thank you, by the way. But yeah, any questions, anything anyone has, I look forward to seeing everyone in Montreal. It's one of my favorite cities. So when I heard that it was there and I got asked to speak, I was 100% in because it was Montreal for sure.
Yeah, we're looking forward to a great meeting. And thanks so much for spending some time with us here. I know you're really busy. You're up at Coy's right now
Yep,
teaching. So thanks for carving out some time for us.
my
Really
pleasure.
appreciate you having you on the show. Thank
Thank
you.
you.
Yeah, I'd also like to thank our producer, Kristen Gover. If you like what you heard, please like and subscribe to our channel. You can always find us on Spotify, the AGD app, SoundCloud, Apple Podcasts, and on YouTube under @General Dentistry. If you have any questions, concerns, comments, or suggestions, contact us at news@agd.org. Thanks again, and we'll see you next time.